Is your hair trying to tell you something? These hair issues might be signs of bigger problems.
I don't like the sound of that.
The first and most obvious thing your hair can tell you is that you're too stressed. While everyone deals with stress from time to time, repeated exposure to stressful conditions or trauma can lead to a hair problem called telogen effluvium, or TE. This is essentially a reaction to stress that leads hair to falling out faster than it typically would. According to the American Academy of Dermatology Association, or AAD, a person will shed around 50 to 100 hairs daily under normal conditions, but someone with TE sheds much more hair, so much that the loss is quite noticeable. There's good news though. The AAD goes on to state that TE tends to be a temporary phenomenon. Once you move past your stressful situation, your hair will likely return to its regular thickness. With that said, if you deal with your anxiety and still experience TE, you may want to see if your TE has been triggered by something else. Problems such as hormone fluctuations or a serious illness can also be root causes of TE. The next way your hair can warn you that something is off is by splitting or breaking. Is this something you deal with regularly? Does it seem like your hair is always dry, even after you apply tons of high-quality conditioners and serums? Your hair might be trying to tell you to keep it out of the sun. When hair is repeatedly exposed to ultraviolet rays, it can start to break down. Although your hair can't technically get a sunburn like your skin can, it can begin to lose its luster due to progressive and cumulative damage. Dermatologist Dr. Wilma Bergfeld expounds on why direct sunlight isn't a friend to hair, telling Cleveland Clinic, "If your hair has prolonged exposure to the sun, UVA and UVB rays can damage the cuticle." She adds that without intervention, the hair can become irreversibly bleached or gray. To fix this issue, experts at GoodRx Health advise wearing something on your head, using an umbrella, or staying out of the sun during the hottest points of the day. They also recommended taking measures to keep your scalp from getting burned, such as using a sunscreen powder so your hair doesn't get greasy and the top of your head is well protected. Another thing to look out for is if your hair pulls out easily by the roots. Although most individual strands of hair can be pulled out fairly easily, they shouldn't just give without any resistance. If you're experiencing this phenomenon, it could mean your teeth are at risk of developing cavities.
Come again?
Though at first glance, dental enamel and keratin might not seem to have commonalities, they do. They both require protein to develop. As such, a study in a 2014 edition of the Journal of Clinical Investigation noted that there seemed to be a correlation between people with weak dental enamel and insufficient levels of hair keratin. In other words, when you can pull your hair out without issue, you may want to schedule an appointment with a dentist. Another thing to look out for is thinning hair. If this is something you're dealing with, consider talking with your healthcare provider about the value of increasing your intake of vitamin D. Researchers have studied the potential link between vitamin D and hair growth, or loss, for years. In a 2017 analysis published in Dermatology Practical and Conceptual, mice who were systematically deprived of vitamin D started losing their hair. The researchers determined that the reason for their thinning hair was a vitamin D deficient diet. Does this mean that you can just take more vitamin D and suddenly have a luscious mane? Of course, it's not that simple, but it at least increases the chances for hair regrowth. A 2021 review published in Curious concluded that both ingested and topical versions of vitamin D have shown promise as treatments for hair loss. Another 2021 study published in the Journal of Nutritional Science and Vitaminology found similar results. Female subjects with hair loss who were given regular oral doses of vitamin D experienced significant hair regrowth. It's important to note that vitamin D won't necessarily cure male pattern baldness or bring back lost hair. Still, it could be worth a shot if you're balding in places. Not all hair worries have anything to do with breakage, thinning, or brittleness. Hirsutism, or hair that grows in unexpected places, can be alarming, particularly for women. For instance, a woman diagnosed with hirsutism might grow a substantial amount of hair around her mouth or on her chin, stomach, or chest. Though hirsutism can happen for a variety of reasons, it's worth noting that it's a symptom of a hormonal condition affecting women called polycystic ovarian syndrome, or PCOS. Women who are diagnosed with PCOS have overactive ovaries. The ovaries go into overdrive, flooding the body with an imbalanced mix of hormones. In response to the deluge of hormones, the body starts to grow hair on unusual places. Though hirsutism doesn't always accompany PCOS, it's a known symptom for about 7 in every 10 PCOS patients. This doesn't mean you're destined to be told you have PCOS if you have hirsutism. The Cleveland Clinic notes that some cases of hirsutism can be due to genetics. And non-PCOS-related hirsutism can be addressed in several ways, including dropping weight, going on birth control pills, and undergoing laser hair removal therapy.